Good evening and welcome to The Square. Tonight is a very timely conversation. It's going to focus on the COVID-19 pandemic and look at the spike of infections in Rwanda in the recent days, as well as look at the vaccine development that's been announced by the government of Rwanda in providing this vaccine to its people. Of course, most of this conversation comes after the cabinet meeting directives that were issued on Monday this week, looking at how to better regulate this pandemic amongst Rwandan citizens. Joining us on the show today, we are joined by Dr. Savan Sanzimana, who is the Director General at Rwanda Biomedical Center. Dr. Savan, great to have you on the show.
Thank you.
We also joined, as always, by the resident panelists. Charles Haba, great to have you on the Square.
Same here, Dan. How are you?
Good.
Good.
Also, after a long hiatus, we're joined by Brenna Namaka. Brenna, great to have you on the show.
Thank you, and
great
good to be back.
Great. So I would like our cameras to just go to Dr. Sabah. I know when we started, we didn't see him on screen. Just to tell you, Dr. Sabah, we thank you for joining us. It's been, I know, a tough period managing this pandemic, and we are really appreciative of the fact that you made time in your busy schedule to come to the Square.
Thank you.
Great. So before we kick off, we always have midweek highlights from the Square resident panelists, just things that have caught their attention that I'd like to share in the middle of the week so far. Charles, is there anything you'd like to share with our guests?
I think in the interest of time, I'll just shoot to one direct thing. In the media today, there is a story around I think security officers, security officers across the region who are in Kigali, across Rwanda, Burundi, Tanzania, Uganda. And so we are quarreling across the region, but we are meeting. And I'm told this is in preparation to the ministerial meeting. My anticipation is that after the ministerial meeting, we have a heads of state meeting. But talking is always extremely important, and we remain optimistic that ultimately guns will be silenced.
I hope so. I really hope so.
Yes.
Brenna, like I said, after your brief hiatus from the show, welcome back. Any midweek highlights you'd like to share?
Yeah, just one on revenue sharing. I think recently, it's 2 weeks ago, we had Unilever plan the second phase of tea, the investments in tea in Rwanda. And so far what we know on the ground, the revenue sharing is not happening. So if you go to some of the places that grow the best tea, it's absurd.
The best tea across the continent?
Yes. No, in Rwanda.
In Rwanda?
Yes.
Okay.
You find children walking to school. You find malnourished children. Within the same space, they produce the best tea. So I feel that what has been done with conservation should be replicated across.
Absolutely.
Because this year already we know the plans around the high value, there are, what's the word?
Therapeutic crops.
Yes.
Yes.
So I think revenue sharing needs to be replicated.
Absolutely.
You know, you can't grow the best tea and then you have people walk to school, barefooted, and I think it's quite unfair. So I hope that whoever is in charge, really, phase 2 should try and address that.
Absolutely.
Yeah.
I agree with you. Thank you very much for your midweek highlights, Charles and Brenna. I would like us to now go to, once again, thank our guests for being here with us. This is a conversation that we need. We've been looking forward to having on the Square with, the leadership behind the command post that is working tirelessly to manage this pandemic in Rwanda. So, Dr. Sabah, the first question I'm going to ask is to do with the spike in infections. And this came, after lockdown, after the curfew hours, and the last, I think, 2 months, there's been a spike in terms of infections, and I also want to talk about the new regulations. So like I said earlier on, the directives from the cabinet meeting on 14th December led to decisions on curfew hours that have been increased, as well as social gatherings that have been halted, amongst other directives. Of course, this follows district measures follow the spike in the COVID-19 coronavirus infections. There were 230 new infections and 2 deaths just registered on Monday this week. I'm sure we're waiting for the reports for tonight. And if you could just share more information on the possible reason on the spike in new infections, as well as plans, how these regulations that government issued out, how these regulations aim to curb the spread of this pandemic, especially during this festive season.
Great. Thank you very much, and also for having this, but also for discussing this important issue of this pandemic going up and down, and also why is these infections increasing this particular time. So COVID moves with people. So as far as people move and they're not protected enough, there's a virus that will come from one person to the other. But if you look back into how the different activities were actually reopened after the lockdown, you'll see how the cases also increasing as movements of people increase, as particular groups that are living in communal places also increasing. So for this December, also end of November, we've observed cases in particular places like prisons, refugee camps, and also a few cases in schools. And we've seen also people moving and also having some social events in what I would say a high speed, like organizing birthdays and other household-based events. So to me, those are the key areas and key routes this virus has been taking while we were enjoying life and thinking that maybe COVID is over. But yet COVID was actually preparing to hit back. And the cases we are recording in the past 1 week were more than the cases we've had in 1 month, actually after August. So why these cases are increasing, as you asked, it's simply that people are not taking the appropriate measures to stop this virus from one person to the other. And why people are not taking those measures? There are many factors, but to me, the individual responsibilities, of course, the element of feeling this kind of fatigue that comes with time, where you are told, don't do this, do this. But we were about to reach our, I'd say, the missing piece of this puzzle, which is the vaccine that would top up on existing measures to fight this virus in a comprehensive way. Because what we're doing was just a few things, and we're missing the most important element we've seen in many pandemics in the history that has changed, like polio. Without vaccine, we will not have eliminated polio. Without vaccine, we will not eliminate it, or closer to eliminate hepatitis B and the other diseases. So to me, it's not time to engage into this fatigue. And the measures that the government came up with in the past 2 days were necessary, because we've seen how these measures break this spike of the cases in just a few weeks. Then we can come back to the level we control. We have several indicators we check. One is the number of cases we report every day. But the key indicator is how many people are getting into hospital, into our treatment centers, how many people are dying from this virus. I remember in the past 4 weeks, we had only 10 people in treatment centers severely sick, under oxygen or not. But nowadays, actually, the beds are about to be completely full in our main treatment centers, and those on oxygen are close to 20. And if you see this tendency and this increase of cases, you must take measures like been taken by the government on Monday. So I think we continue to be like firefighting mode, people taking there are measures in individual kind of lens, but also looking into what the government can do to protect people and adding on what we have to do as individuals. So this is important. There's no one single way of stopping the virus. It's a combination of several measures from people, from government, from community. Enforcement is necessary until we reach the time we are all safe. But we are not yet safe as far as we have these 80 cases, 100 cases every day.
I think just before I let Charles and Brenna also in, I think something that you mentioned I found extremely informative is when you said the beds are full, people on oxygen, on ventilators or what have you. The cases just shot up in the last 4 weeks. And I know one of the things in trying to maintain this virus is not to overwhelm the healthcare system. Do you think this sort of messaging, the gravity of the pandemic, I think this is what's missing, because to most Rwandans it's 56 people dead at the end of the day in the grand scheme of things compared to how many people are dying of malaria or diabetes or HIV. I think the messaging, the awareness to Rwandans needs to also focus on the gravity of the situation and sharing some concrete examples, somber, grave numbers that you mentioned. Do you think this is something that's in the pipeline, or this is something the different stakeholders involved in maintaining this pandemic are thinking of doing? Just messaging actual cases of people, not only who are affected by this, but the gravity of the situation.
Sure. If you try to compare different diseases and pandemics, you'll see the difference between COVID and the other viruses and the other epidemics or pandemics. So we are still dealing with many other similar kind of diseases. We still have HIV, we still have measles, we still have malaria, we have tuberculosis. And as you rightly say, you can't only look at one disease in number of people dying from that disease. COVID has two major challenges. One, it's highly infectious. So within a day, one person can infect hundreds. And second, it can kill someone so quickly. We've had cases like someone who passed away yesterday was in between, actually started with the normal flu. And while he was consulting, trying to get to know, it's flu, I know how to manage my seasonal flu, then it goes into complication, then the lungs are not able to function as normal. And in a matter of just hours, he was not able to breathe normally. And this happens several times in Rwanda or elsewhere. So COVID can kill someone in just few hours. Someone starting with just coughing and a few fever. Oh, I know how to manage when it rains. Then you go to bed. Then the morning, things have changed completely. So malaria is one of other diseases that can kill you so quickly, but it takes 3 days maybe if you don't get treated. Unfortunately, COVID can be the symptoms can be confused with other diseases. And sometimes, is it malaria? Is it COVID? Is it just fatigue? Is it just because I have my normal flu? Then this is what we are getting. People are getting to hospitals just simply because they don't know they have COVID, or because they don't think COVID can take them from just simple life like I am like right now, and just tomorrow you are in another situation. Number two, COVID, actually number three, because I wanted to highlight what is specific for COVID. COVID can attack and destroy so many organs, particularly the lungs. We've learned in medicine that most of the pandemics will come from respiratory system. Something that passes through the respiratory system, it's always hard and difficult to manage. So unfortunately, we have COVID, And we have other diseases that have shown that comes from respiratory system and affects people rapidly. You don't know who is going to get complications. You don't know who is going to manage it with a natural immune system. And this is what makes it difficult. Initially, we thought is for people who have other comorbidities or elders who may have complications. But now we've seen young people like me, like you, starting with just a normal cough and flu and fever, then next day, it's another story. So COVID is not a fake disease, as some people say. COVID is real, and it kills so fast, and it spreads so fast.
Thank you very much. Berna, would you like to weigh in?
You know, it's difficult to talk to a scientist because they are speaking from, you know,
evidence.
Yes, from evidence. So my input to what he has just said will be very limited. But what I picked from what he said, I think one thing is clear: self-medication. You know, people get sick and they treat it as a flu, and then before you know it, things get out of hand. Now there's that, but also perhaps the testing had gone down, because if you were testing as much, probably you would be able to detect some of these cases. So I guess there are better qualified people to guide on this process, but I feel that one, the issue around self-medication, again, is a big problem, and also testing cannot stop. We'll talk about the vaccine, but if you ask me, I wouldn't talk about the vaccine at all, because it's out of control. You know, it's being developed somewhere, and when it arrives, it's not really within our control. But there are things that are within our control, which is what they've been telling us to do: social distancing, you know, making sure that you're wearing the mask properly, washing your hands. That's within our control. And I think the narrative and the focus has to remain on that. When we talk about the vaccine, I think we are kind of getting ahead of ourselves, in my view.
When you talk about self-medication, I have a quick question for you, and also to Dr. Savin. One of the questions I've asked myself to do with the COVID-19 pandemic, or the coronavirus, is that a lot of the authorities on this topic will usually talk about masking, social distancing, washing your hands, but there's rarely any information on how to boost your immune system when it comes to your diet, when it comes to just stopping all negative behaviors, whether it's alcohol, whether it's smoking, whether it's drugs. There's sort of limited information on how to better take care of yourself, because the information we get is that one of the ways it really affects people and leads to dire consequences is also through low immunity. So Dr. Savin, can you comment briefly on that?
Mm-hmm. Sure. As I said, COVID can affect people differently because people have different immune system, like defense, like antibodies. Generally, people don't know how the antibodies are standing. You may believe that my defense is enough, is good, and yet it's not. So what happens? COVID started by killing some cells that are in our defense, and the cells in our body don't know exactly where is this virus coming from. So that's why the importance of boosting your immunity comes in. How? There are several ways. Number one, of course, goes with what you eat, how you treat your body, without necessarily taking medications. Because medications always are not very helpful when they are not needed. Because naturally, some medication will just help you to boost your own natural defense and attack the bacteria, the virus, whatever is coming out into your body. And some medication can also have some side effects that can also lower the defense. That is a fact. So I always advise people to not take medication if it's not recommended. So self-medication, auto-medication, it's not an option. But many people do that, but I personally don't recommend. Either if it's a normal feel fatigue, you go to the pharmacy, you buy medicine, then you take the medicine. Sometimes you can get the opposite result from what you thought you're doing by lowering your immunity. So there are many natural things you can do by taking care of your body, your food, enough drinks. The best drink is water. The best drink is water, worldwide. Enough water. Sometimes you take very little. But if you can take more than 2 liters a day, that is great. And you need fruits. Of course, your body always needs fruits. Sometimes you say take at least 5 types of fruits every day. But how many fruits do we take every day? Maybe 5 types a week if you are so strict. But 5 types of fruits every day is a standard, but we are always, most of us, starting from myself, we are always below the standards. Fruits and vegetables is key because these are booster of the immunity. So in COVID, we advise people in home-based care when they have been infected to all these details: food, drinks, take rest, sleep. Don't overwork. Some people were going to home-based care. Then it's time to work on their emails, to work on their documents, the computers. They work so hard, many hours. You're also reducing or lowering your immunity or defense. That is not recommended if you are told to do so. So sometimes the people always find advices to tell, oh, you know what? I have some type of medications or herbal mixing or things that will come to help you. But these are not advised by our protocol. They're very simple things. Just take care of yourself if you think you have COVID or if you think you may get COVID. But your mask, your other public health measures, distance, the most important protection measures. But if you need to work on your immunity, you don't work on it when you're sick. You work on it before you get sick.
Absolutely. Charles, would you like to weigh?
I mean, in military science, one of the things that they teach you, not that I have been, but the best form of defense is attack. And I'm sure that's what Dr. is talking about. I did make a disclaimer right there, not that I've been. But I think that's what Dr. is saying specifically, that the best form of defense is attack. So the COVID-19 virus, you need not wait for it to defend yourself against it, but attack and be ready to take it head on. And some of the things that he's talking about are pretty basic if you look at it. You know, how do you boost your immune system? You know, today when you go to all coffee shops in town, most of the ones that have a name to do with you will take like ginger lemon tea, and these days they call it COVID tea.
Oh, is that so?
Yes. So you'll have a salad, and if it has then have a lot of ginger, they'll tell you onjeramo cha COVID. You know, so there's a lot of these things that's happening. But my sort of intervention has a lot more to do with the role of government in all this, and around communication and a better way of doing these things. So, and I do not want to make any blame game here, because nobody ever anticipated what we were going to dive into. It's been 9 months since the first case came into Rwanda. So, for lack of a better word, let me call it, at the risk of sounding trivial, let me call it 9 months of COVID. 9 months of COVID, we have 58, I stand to be corrected, Dr. 58 deaths. Quick numbers tells you that it is 6 people dying per month. Because people don't die in decimals, they die in wholes. And then it's very simplistic for you to imagine that there are so many other deaths that are occurring in excess of 6 people per month. Even if you take one example of motor accidents. But that's extremely simplistic. If you look at how much it is costing the government of Rwanda to save one life, it's extremely expensive. And I believe, and I want to supplement what Diana said earlier on around the efforts in communication and what have you, is that when we look at the efforts that we are, the amount of money that we are spending in saving lives versus the amount of money that we are spending on making people aware without being militaristic, because that is another problem I have with, if Afande Kabera was on this show, and I do hope that we can have him on the show, is that they have an approach that is not necessarily solution-oriented. The government of Rwanda is bleeding through its nose to save lives. Bundling people in buses, spending the efforts on law enforcement around COVID versus, and if we were to compare dollar for dollar, versus the efforts in saving lives, we can do a lot better in making sure that people don't get to the extent of being on ventilators. People don't get to the extent of on being on life support and what have you, if we do things right. And that's sometimes, I think this has also become an anthem on the square around the institutional coordination. And everybody had all sorts of memes around the ministerial meeting that was on this show on Sunday. Around, you almost feel that every institution wants to protect itself in its own way. Yet we can easily say, what does it take from a long-term perspective? The best example to give is HIV/AIDS. When the government of Rwanda woke up in the morning and saw that its people were dying, we put condoms everywhere that it mattered. What efforts have we done? You almost see that the biggest efforts are around policing. As if, yes.
To clarify, for my sake and of yours, I think you're making some really interesting points. But so what is your point exactly? Like, what are you saying government can do better? What is it? Because from what you're saying is that there's too much effort spent in policing people.
Yes.
Vis-a-vis too much effort.
So I will give.
Let me finish my question.
Yes,
or too much effort spent in policing people, where there should be more effort in developing capacity for treating people. Is that what you're saying?
So I'll give an example around the health sector, and I'll give an example around law enforcement.
Yeah.
In the health sector, try to walk into an Aldea Daktari to leave this show and go into King Faisal or Sehash Yuka or one of the hospitals. You will see people literally piled on top of each other trying to pay a hospital bill or trying to walk a paper medical bill from one patient to another to a medical officer and so on and so forth. You will see people being driven in cramped up vehicles to a medical center, a health center, centre de santé, for medical attention. And then you ask yourself, that social, first of all, the person is already sick, right? So the message that we are spreading out of say a high concentration center like that, and I'm glad Dr. talked about prisons and refugee camps. That's because it's very difficult to social distance people in that establishment. if you go to medical centers, I wouldn't say it is difficult, but it's because we have not made a deliberate effort to make sure we arrange.
But we have more deliberate efforts on policing.
Exactly.
That's what you're saying. There's a big discrepancy.
Yes.
Very interesting. Dr. Saban, would you like to weigh in on that before we go to the next part of the conversation, which is the vaccine development?
Sure. I want to explain how we manage pandemics. There are 4 steps in pandemics prevention and control. One is preparedness. There's no case, there's no disease, you're in green, you're just building your system. We went through this phase up to March 14th. So this is probably the most critical phase because you don't know exactly how the enemy will look like. And you're building the army sometimes in the wrong place, sometimes you're just guessing. So we passed through this phase. We went to phase 2 when we got the first case, and the cases, where it's coming
Finally,
from.
a government official is saying that they are guessing.
Sorry, carry on.
No, this is a scientist saying.
Yes.
So. The phase 2, you're trying to understand where diseases are coming from. Sometimes it's imported case. We had imported cases, and you know how to manage these cases, and you contain in a particular place. Phase 3, sometimes called containment. You have cases spreading in some places. But you can tell, you can manage, you can connect you to the other person and say, oh, you infect this, and I know where you are, and I can manage. We went through this until June, when we went to Rusizi, and Rusizi went to another. Rusizi was the first case to go into phase 4. The phase 4, sometimes called mitigation phase, there is a spread. You don't know who infects who, and where is the virus. So now we are in phase 4 everywhere, in Kigali or in other districts. So in phase 4, what you do, you try to prevent morbidity and mortality of this disease. In this case, it's COVID. So I started from theory so that you understand what I want to explain for COVID. So sometimes for each phase, you anticipate to avoid more damages. For phase 1, you anticipate to have the case. For phase 2, you anticipate to have more cases. 3, you anticipate to not go into massive transmission. And when you're in massive transmission, you anticipate to not having many people dying. And these efforts not have a cost. You can't cost one life. You can't cost 2 lives. You just make sure, if you see the trend, you stop it before it goes into a situation where you don't even control. We've seen countries waking up and see heads of state, prime ministers, ministers saying, we are overwhelmed, we need support from other countries. You've seen this. So we can't afford to go into that situation. That's why people are trying to detect and always try to be in advance of the situation of the disease. So while we are in mitigation phase, we're trying to anticipate that we have thousands of people dying. And what the government is doing is exactly what the epidemiology theories have said. And as a scientist, as a doctor, as someone also in charge of as an institution on the forefront, I'm always happy when I connect these 2 theories to save even one life.
Can I just?
Thank you very much.
Yeah. And first of all, I'm extremely impressed by one of the things that I was, and I know this might not come on too well with Bana, is that during the festive season, the lockdown is going to start at 8 p.m.
Lockdown,
Curfew, sorry. Thank you, Diana. I think that's one of the most prudent things. Yes. I think that's one of the most prudent things that the government of Rwanda has thought about, because excitement and that's one of the most difficult things to contain. On Saturday, I was at a wedding of one of my colleagues. And as soon as I walked into that wedding, I was scared, literally. I went back. I sent a text message to my colleague who was at the wedding. I said, when it is time for us to give a gift and make a speech, let me know. So I came and sat quietly in my little corner. When that time came, I went, that was done, and I walked out immediately.
Because
now, yes, there's just nobody cared that we were in COVID times, right? But that's just one event. There's just a myriad of all those events. So imagine we're in a festive season, and New Year's is probably the best example to give, with fireworks and all that. So on the one hand, honestly speaking, as far as the government of Rwanda is concerned, hats off to Daktari and your colleagues in the government. When it comes to the festive season and the decisions they've taken, they're extremely impressive. On the other hand, I think the coordination around how that message is passed on is what is lacking. And so for instance, the other day I saw people who were rounded up at the downtown. These guys, 6 months ago, less than 6 months ago, were told, for you to resume your business, you have to do X, Y, Z.
Hand washing station, etc., etc.
Is it their fault that whoever was supposed to ensure that they were doing it or not doing it was sleeping on the job? Now, their businesses are closed. They have been fined a fortune, and it's a lose-lose for everybody. Did the cases spike because those little traders down there were not making sure that everybody who walks into the shop to buy a pair of socks has sanitized?
Yeah.
So, yeah.
I think we need part 3 and 4, Dr. Sama, of this conversation. You can see it's not a discussion we can have in just one show, but unfortunately I'd have to direct us to the next part of the topic, and which is the vaccine. I personally, I am very keen on this topic. I have many questions about the vaccine, as I'm sure Charles does, as I'm sure Bernard does, as I'm sure also our viewers do. So according to the Minister of Health, the government of Rwanda is ready to acquire the coronavirus vaccine in 2021. I think today in the live presser, it's not the first quarter, but I think sometime later on in the year. And these vaccines are namely AstraZeneca as well as Moderna. Upon securing the vaccine, the minister also mentioned that it will be free of charge to primary beneficiaries. So my question to you is, one, how will government of Rwanda identify who primary beneficiaries are? And two, this vaccine, is it mandatory? Is it compulsory? And how will the ministry also share information? I think this is what a lot of people are asking about its side effects, its potential side effects.
Thank you. So in terms of who is going to receive the vaccine first, the key categories that we knew even before the vaccine was approved for emergency use. Category number 1 is those people with existing conditions, with comorbidities, and these are the people who actually have most in our treatment centers, because when COVID adds up on diabetes or cardiovascular diseases or asthma or similar conditions, sometimes the complications are even worse. Category number 2 is those people who are 70, 75 years old and above. Sometimes their immunity defense needs a boost more than young people. And vaccine is all about just a booster, a catalyst, just something that helps your body to defend itself. And of course, frontliners, doctors, nurses, those people, as you mentioned, in hospitals who are receiving clients with symptoms, they need to be protected for them to not get the disease, but also to not transmit the disease to other patients who will come after. And also think about other frontliners. You've talked about law enforcement personnel. They also in part of this category. So we counted about 20% of Rwandese needs to be vaccinated to have an impact on COVID control if we have to go to that phase. So unfortunately, we can't get all the vaccine we need, but otherwise we would vaccinate everyone. So the way we are going to give it, it's not going to be, we're not going to be forced to take it. So it's an opt-in. You'll be asked if you want to take it or not. And we believe that these people who are at risk, we actually, the acceptance will be much higher.
Thank you very much. Brenda, do you want to weigh the vaccine and also just the discussion we had before the vaccine?
Like I said before, I just feel the discussion around the vaccine is actually a bit, not premature per se, but the direction, I think. One, the criteria is universal in terms of who gets it first. So it's not decided as such locally. Two, I think the bigger challenge is around the logistics of the vaccine. And so far we haven't had a lot of discussion around that, the logistics. Because the vaccine, you're not making it so it could be available even tomorrow. But if it wasn't made available tomorrow, 20%, do you have the capacity to actually distribute it? Do we have that capacity? I don't think so. Because so far what we know in terms of what is required, it's a very complex cold chain system. Yes, that's one. Logistics.
Skilled personnel as well.
Yes. And some of the things actually are basics that you may not think about. The vaccine is, they use needles, they use syringes. So do we have enough, for instance, in stock? Because as we speak, there's a lot of demand globally for the same product, So I wish we had more discussions around the logistics, because that is somehow what will determine whether it works, when it's made available. We are not making it. We have to get the money.
To roll it,
yes. So the logistics of when it's on the ground, the cold chain, and as far as I know, there would have to be a major upgrade of the system. The other thing is around looking forward in terms of communication. Already, there are people who feel that as we talk about the vaccine, they need to be relaxed because their government is going to provide the vaccine. So, as on one hand, you have government saying, be very careful, safeguard, protect yourself. On the other hand, you have people who say, oh, the vaccine is actually going to be available and it will be for free. So perhaps I can do whatever I want, So the bigger challenge is actually making sure that people remain safe until the vaccine is available in the country. And I think the communication around the vaccine should be safe until the vaccine arrives. Because it could arrive and you're not, you're dead.
You're no longer.
Yeah? Yes. So, and
yes.
Also the other thing, I think what we've seen around the world is the myth and the misconception around vaccines. It's a big problem. Yeah.
Especially vaccines that are on the continent from the West.
On the continent from the West, but also over time, there's a big, I don't know what to call them, theorists that have been decampaigning vaccines, the effectiveness of vaccines. So we can't take it for granted that ordinary Rwandans will warm up to the vaccine. So a lot of forward communication for me around the vaccine has to be the awareness and the transparency about how it works. First of all, stay safe so that when the vaccine arrives, you are alive to take it. And two, address the issues around, the logistics. And three, demystify the misinformation around the vaccine and its effectiveness.
Charles, we're running out of time. I just want Dr. Sabah, but hold that thought to the closing comments. Dr. Sabah, I would like to respond to Brenna's comments. Yes, I would like you to respond to Brenna's comments.
Sure.
On logistics around the vaccine, demystifying theories around the vaccine, as well as communicating even better about the vaccine between now and when it comes through.
Right.
Very briefly.
I think it's key to acknowledge that there are several types of vaccines that are coming. The first one that is already being used in some countries, the Pfizer vaccine, developed in partnership with BioNTech, is the most complicated in terms of logistics and transport. It needs deep freezers up to -70, and when you have to transport it to other countries, it requires some special logistics. But for Rwanda, I want to say that we've been preparing for this, and this is not going to be a big issue for us. As far as storage and transport, but also supply chain, the existing vaccine supply chain is concerned. The other thing I want to highlight that personnel or the skills to use this vaccine is not an issue, because we've had several vaccines. As we speak, we are vaccinating 200,000 people for Ebola virus disease, which is quite similar in terms of injection site, in terms of syringes, and how we manage other criteria, other standards. This is not going to be a challenge. There are many other vaccines that are coming much easier, like the AstraZeneca, but of course the trials are not yet completed, and they had some issues to fix. So this one would have been even better, cost-wise, logistic-wise, but again, we are not yet there. So one thing I want to highlight with what we said about people's misconceptions. For every vaccine we've initiated here in Rwanda, we've had this kind of people saying, "Oh, it's going to change people's DNA. It's going it's a tool to change people into some supra or extra humans in a way that, But I want to say that none of these vaccines is going to change or to enter people's DNA. Because if I take the example of this one that is already being used, the Pfizer vaccine, it's just a messenger. It's like an information that is given to the cells to tell, look, you need to produce some defense. It's just a music, that voice that tells, wake up. It doesn't enter the DNA of the cell. What it does, it just giving the message, then the cell will develop some defense we call spike. These spikes, this virus has some spikes all around it. So our own cell will develop similar spikes because this vaccine has been injected. And when these spikes are developed into the body, our natural immune system will now release the soldiers, the antibodies, to go and defend, something terrible has happened. This is how this vaccine works. It doesn't go in DNA. It's just simply wake up, then the body will do itself what it has to do.
Thank you very much, Dr. Sabah. I'd like us to just quickly go to our social media feed and just read some of the comments from our viewers. We have the first tweet coming in from Frank Kienza, who's a regular tweet on the show. He says, not the best time for conspiracy theories, but the truth of the matter is, in addition to climate change, COVID-19 is yet another reminder of how the human race is on a fast track to extinct itself. And that this kind of connects with what you're just talking about, those theories of how the vaccine may not work as how it's supposed to. And then we have another tweet coming in from Romeo, who states that Any particularities on how we respond to the virus on local cases research better than European countries do? So he wants to know, compared to European countries, how are we responding better with local cases? And the last tweet, also from Romeo, also states that, if we can have that on our screens, how has this changed, accelerated thinking and planning on long-term resilience initiative, like local research and development and pharmaceutical production of medicines, diagnostics, and vaccines? So very quickly, Dr. Sabah, in less than a minute, if you can just tell us this pandemic, how is it, we've talked about the show, on the show COVID-19, the silver lining is that it has fast-tracked or made us leapfrog certain initiatives, whether it's in the private sector, whether it's in health, whether it's in technology. So on the ground, on our health practitioners in our health industry, health sector, where are we in terms of how this pandemic has most likely fast-tracked R&D or, pharmaceutical developments? Just very briefly.
I think it's going to be a game changer into particularly vaccine development. If we never thought that we were going to have a vaccine in just 8 months, because usually it takes 10 years. This is going to change for other vaccines, particularly this technique of developing a messenger-based vaccine, messenger RNA, this kind of info. This is the first one. We never had similar vaccine. Usually we take a virus, they kill it, then they inject. This is the usual vaccine. But now, taking information and injecting into a vaccine, we are going to have probably more vaccines that we've been waiting for, hopefully for HIV and other diseases. Probably we are going also to have new treatments, like for cancer, that are based on this similar technique, that we're going to inform ourselves to defend themselves. For Rwanda, of course, COVID has put us on the same kind of starting point. When it started, we've been all learning on COVID, and we've done some interesting research. If you look into our lab, how our scientists have tried so many things, and now we've developed, for example, this pooled testing system that many countries are using. It started as something to try because we don't have solution. So I believe that COVID has brought so many damages, but also COVID has helped people to think beyond and try. Many things and many discoveries have happened and will continue. And we've seen it in other situations, World War I, World War II, so many diseases like these antibiotics were developed. When people are passing through crisis, the brains work faster and humanity benefits sometimes from this crisis.
That's like the saying, humanity, is the mother of invention. Last tweet for the night, before we give our closing remarks, is from Tui Senje. And Mr. Jackson says, very interesting topic of today. Many people have negative perceptions about the vaccine. I think more awareness-raising campaign must be conducted to assure that citizens understand the importance of the vaccine and remove some biases. So this is a view echoing what we're saying on the show. Definitely more communication and awareness needed. Charles, very quickly, closing remarks.
If I was to give Daktari and his team marks out of 10 in as far as the way they've managed the pandemic, I think I'd give them 12 out of 10.
Or 20 out of 10.
I it's hats off purely, I've traveled quite a number of times within the country and out of the country during this pandemic. I hats off for the way they do their job when you arrive at the airport, when you go to whatever you're doing at the hotels and what have you, online, getting your results and what have you. It's I've not seen anywhere. You go out of the country, you arrive at airports in other countries, and then they ask you if you're from Rwanda, and you have a special line. Honestly speaking, Daktari and your team, I wish I could give you a pay rise. But that said, I think the onus is really on us, and the reason that the recent cases have spiked, in my opinion, is that there's been huge laxity on our part
as individuals
and also on law enforcement part. So I think let's not slack. We need to have a good 2021.
Absolutely.
Yeah.
Brenna, very briefly, closing remarks.
I think that we keep saying this, and I wonder whether we mean it when we say we are grateful for the work that they are doing. because you don't say you're grateful and then you create more work for them.
That's true.
You know, yes, because you may recall that at some point there was a social media campaign to be grateful to the frontline workers. If we were the same people that were grateful on social media, why are we taking them back to work? I mean, he would like to have a quiet Christmas with his family, and he can't have that, you know. So I feel that if we are going to say we are grateful to everybody who's been at work for the last 9 months, then let's do our part.
Absolutely.
Yeah, I think that's better than just,
Absolutely. I love that you put that.
I just want to say one more thing. Bana and Sabe, I want to report Diana, she wore my colors.
Dr. Sabah, very quick closing remarks, and I just want to conclude on my part by saying I just love the way you explained it in layman's terms, especially for me who the vaccine is something I needed someone to really comfort me and talk more about it, especially the RNA part and, you know, all these theories that it converts your DNA and will make you, you know, zombify you, you know, there's just so much better. And then you explained, no, it's just like music, you know, to your immune system, and very great explanation.
His
and I
first
hope
job was a teacher.
I hope we'll have you on the show again. But very briefly, closing remarks from you, Dr. Sabah.
Just a few things. Number one, if you've been able to protect yourself for 9 months, please, you need just a few months to go to the end of this pandemic. Put on your mask, take your distance, and wash your hands. Wherever you are, this is what you're asking you to do before these vaccines come to help to end this war. But if you don't do it, we'll have just destroyed everything we built. Please, let's do it. The last point is, with COVID, you need to learn every day from everyone. So with these vaccines, with this science has changed, has evolved. I probably came here one time saying, no, it's not time to wear a mask. But now things have changed. Science is coming every day, and we'll be probably coming here saying other things that are more up to date. So let's work together. Last thing, with great leadership, with coordination, everything works. I always want to highlight a triangle that is making Rwanda achieving what we're achieving. When you have the leadership on top, from His Excellence up to the Mudugudu lead, and then you have scientists on the left, and then you have the community on the right. This triangle can make a difference, and it's working here, and I hope we get to the end still under this coordination, and I believe we'll make it very soon.
Wow, Dr. Sabah, thank you very much. Thank you very much to our viewers. Please keep the conversation going using hashtag #TheSphereRW. As you can see at the bottom of your screen. Charles, always been a pleasure with you on the show. Berna, likewise, thank you for your very insightful comments. To the frontline essential care workers, thank you for the fight against this pandemic. And I really hope viewers who are listening will do our best as we clock into the new year to keep the strides we've been making, to keep them going, stay safe, socialize, wash your hands, do everything that we're being told to do in trying to maintain the spread of this pandemic. I'd like to thank our partners, Uzi Collections, as well as Bourbon Coffee, for always supporting The Square. Thank you for tuning in. Have a good night and see you again next week.